So today I'm going to representing San Mateo County Public Health Nutrition. There's multiple programs within Public Health Nutrition. Primarily, I want to emphasize the Women, Infants, and Children program, WIC, and the Champions for Change, the NEOP grant, the Nutrition Education and Obesity Prevention Grant. Our primary goal amongst the nutrition programs that we have is to empower San Mateo County residents to make healthy choices, the easy choice, and increase physical activity through nutrition education, social marketing, and environmental supports. A lot of our work is similar to what Mary just presented, but I'm going to talk a little bit about our programs and initiatives that support this goal. The WIC program, where, if you're not familiar with it, the program starts and reaches prenatal moms as soon as you know that they're pregnant. It's low-income mothers. This program has existed nationally through the USDA since 1975, I believe. So it's been over 40 years. And they provide nutrition support through counseling and education to moms, and then once they give birth, breastfeeding support when we talk about sustainability and access to food. What better than free food through breastfeeding? And then referrals to other programs that are out there if the family needs support through like public health, nursing that we have through San Mateo County or other programs. The vouchers consist of like nutritious foods. You may have seen in the grocery store the WIC logo. It varies from fruits and vegetables to dairy, whole grains. So those are the primary foods that are offered through the vouchers. Some of the education that's done through the Nutrition Education and Obesity Prevention Grant is garden-based nutrition education. Our team provides garden-based nutrition education in the schools that we're working with. The main school district that we work with is Ravenswood School District, and we do a little bit of work here in South San Francisco as well. The schools that we work with are schools that receive more than 50% or more free or reduced meals. So those are the schools that are targeted that we provide our education. We also do some community garden work, and this is a picture of Friendship Park. This is in unincorporated North Fair Oaks, and it has 30 garden beds, and I like to say estimated growth of 1,000 pounds produced annually through these garden beds. Families contract out each garden bed, and they are responsible for maintaining the garden bed. We have a wait list currently for families that want this garden bed. So it's just a really nice opportunity for them to harvest their own food, and there's a park right next door to the garden beds. Here's some pictures of some of our garden-based nutrition education in the school system. So these are the children who are planting some seeds, and then towards the end of the school year, they're able to harvest. So they've grown a variety of things: carrots, tomatoes, green leafy vegetables, just a variety of items have grown. And they love it because they're able to go outside during the school day and harvest. So primarily we work in elementary schools, and for the young ones, it's been so much fun. And also for the older kids who in the 5th and 6th grade, they enjoy it as well. So we've been doing some work in Parkway Middle School, which is fairly close to here in South San Francisco, and I love to share this quote from one of the students because it's my favorite quote when I read it. So let me just read it to you. "I want to thank you for giving me your time to teach me and my classmates about health and nutrition. I think this helped me a lot. It taught me to be more aware and careful about what I eat. I also learned where sugar and fat can be hiding. I am really inspired to eat healthier thanks to you. It sometimes might seem like I don't care because of what I eat, but I think it's hard to deny your cravings. I try to fight them, but sometimes there are battles you can't win. Now that I'm more aware about my health, I think I will win more of those battles." I believe this is from a 7th grader, so I just thought this was really cute. And this is after we were at Parkway Middle School. We implemented a 6-lesson curriculum, and the curriculum was around community and nutrition, where food comes from, and eating locally. So it was a wonderful curriculum to use, especially with the older students who maybe needed something a little bit more like higher level than just like what I refer to as like the My Plate and where the different food groups come from. And then I have a principal quote, because we had a lot of support from the principal there. "Healthy eating habits are established at home and need to be reinforced at school. establishing healthy school-wide initiatives can have positive impact on social, emotional, academic success, and can ultimately motivate students to participate in programs such as sports, student council, etc. So along with education, we work with school wellness. One of our initiatives right now is shaping healthy impressions through nutrition and exercise. This program works primarily with preschools. It's a certification program through the California Department of Education. And we have started our efforts to work with these preschools and start healthy habits young. So the program really works with the environment as well as what foods are being offered, mealtime, as well as some of the education that's being offered during the preschool setting. And then lastly, the team also works on our retail work. So every 4 years, we complete an assessment of retail stores that qualify within our areas, which is 185% of the federal poverty level. This year, we assessed 20 retail stores, primarily in East Palo Alto and North Fair Oaks. And we assess walkability, what kind of variety of produce that's being offered, marketing on images versus healthy versus unhealthy images that are on the window panels. We also assess walkability, and then we assess the offerings of whether they accept EBT or WIC vouchers. Then after assessing them, we work with the retail store to make small changes. Sometimes it's difficult if there's no funding for those stores, but making small changes. One easy one that we currently work on is just the marketing that's posted on the window panels. Very simple, because we see a ratio of unhealthy postings versus healthy postings. It's like about 5 to 1. So just offering them options to post healthy images. So, and then making it a little bit more attractive. So we also work with the store to make the produce, the presentation of it, more appealing, rather than just in the background like in the store, but just spicing it up and making it look, I'm going to use Mary's quote of making it look a little bit sexier and appealing to any of the consumers. So that's a bit about what we do at Public Health Nutrition, and of course we'll be answering questions through the panel.